Hey friends, welcome to the fifth and final episode of Union Talks Speaker Series. My name is Mike Parker. I'm the President of Health Sciences. I'd also like to take this moment to recognize that we're on Treaty 6 lands and thank the First Peoples for their hospitality this evening. And I think that at 6 p.m. every evening or 7, our lights all go off in the building and they're right on time. So the lights are down for just a moment while we bring them back up. I also want to take this chance or this opportunity to recognize our staff from HSAA that have been involved in the speaker series from Edmonton and Calgary, and also to Chelsea Rhodes, our contractor that's been putting all of this together over the last, I think, 2.5 months. She's been working on this program. So Chelsea's a book writer. Keep your eyes out for her books in the future here, Chelsea. Tonight we have Trevor Harrison with us to present the Parkland Institute's report, Alberta in Context, Healthcare under the NDP Governments. We also have Heather Smith, President of UNA, and myself to offer some responses and discussion following. I want to welcome everyone into the room and who are joining us remotely as well, HSA members, members of other unions, members of the public who are watching us right now live stream. Please send us your questions as this evening goes on, and we'll do our best to incorporate them into our discussions. I'd like to introduce Trevor Harrison, standing to my right. He's joined us from Lethbridge, where he's a professor of sociology in the Faculty of Arts and Science at the University of Lethbridge. He is also research affiliate of the Prentice Institute for Global Population and Economy and the director of Parkland Institute based out of the University of Alberta. And as our talk was going on earlier before we started this event, he's probably got another dozen boards and groups that he sits on as well that we were just talking about, from Washington to Vancouver and everywhere in between. Trevor's a co-author of the Alberta in Context report, along with his colleagues at Parkland, Larissa Stendy, Rebecca Graff-McCrae, and Ian Hussey. This report analyzes and compares the record of recent NDP governments on healthcare in 5 separate provinces: Ontario, British Columbia, Saskatchewan, Manitoba, and Nova Scotia, with a specific focus on healthcare funding, hospitals, staffing levels, and labor relations. The report examines briefly the healthcare policies of the Alberta NDP government since 2015, highlighting useful points of intersections and contrast, with the 5 points also being examined, with the 5 provinces also being examined. Finally, the report suggests 2 broad lessons that may be taken by the NDP government on their policies and their actions. We look forward to Trevor's presentation of these findings, and followed by some commentary by myself and Heather. Trevor.
Thanks so much, Mike, and thank you to HSAA for the very nice invite, and thank you, Chelsea, for all the help you've given over the last while in allowing me to come to this event. Mike has read off the abstract for the report, so I think I'm done, actually. He's covered it very nicely there. I should say the report, as with everything that Parkland Institute produces, is free of charge to the public. And so you can go on the website and you can download the report, so at no cost to yourselves. I hope you'll do that. And go to many of the other reports and blogs and other productions that we put together there. So, as Mike has mentioned, this report it's pretty involved. Mike, it took us maybe 1.5 months to put this together, or was it 2.5 years or something? Yeah, it was a long time. It's actually one of the most involved, comprehensive studies I think that Parkland has ever put together. The complexity of comparing fairly that many governments and also trying to put their politics in context, which is something I'll talk about a lot here. And then to say something meaningful about what's gone on in Alberta with the NDP did add for a complex but really interesting report at the end of the day. So with no more ado, I will get into this. Which way do we, oh, there we are. So, as you can see here, we released this report just earlier this year. And again, it does analyze a lot of financial and historical data. I'll be going over some of it with you a little bit later. Also, government reports from the various provinces and other materials as well, to give kind of a full picture of what has gone on, not just in terms of this? Yeah. Oh, okay. Wonderful. Okay. Tech. Yeah, I'm a sociologist. I don't handle this at all. So we'll just go on. So we looked at the governments as a whole, their policies and what they were really trying to do, and then we narrowed in to look at particularly at healthcare. And again, as mentioned, it compares really the NDP governments in 5 provinces and their healthcare policies: Nova Scotia, Ontario, Manitoba, Saskatchewan, and British Columbia, and then briefly goes into the NDP's record here. These are the 5 governments and the period of time we went into. Now, in some of these provinces, of course, the NDP had also governed before, but it seemed to us that roughly around 1990 was kind of a good cutoff point to go into it. And the really interesting thing actually is, and it struck me at the time we were doing this report immediately, was how many governments came into office, NDP governments, at the beginning of the 1990s. And in some sense, no surprise there, because this was right after the signing of the free trade agreement and serious restructuring, as well as kind of the beginnings of kind of neoliberal push towards austerity. And particularly in the case of Ontario, having to then go into suddenly being in office at a time when free trade came in and a whole series of other things, a recession. That's why the NDP got elected, but it's also created real problems for them. There were, as I said, other NDP governments in place before this time, and I'll go into that a little bit later here, but one of the things we actually argue is that there's a real difference between the NDP/CCF in earlier iterations and the way the NDP has reshaped itself after the 1990s. So in Saskatchewan and Manitoba, and even in BC, where under Barrett, there was an NDP government in the early 70s, it's kind of like I say to people, if you own, as I happen to do, a 1995 Toyota Camry, and then you buy a 2019 Toyota Camry, they're both Toyota Camrys, but they're really different, right? It's the same thing with NDP government. So the label doesn't mean that what they do is necessarily the same. And I'll go into that a little bit more. So as a broad overview, the important context here is that there was a transition of the NDP after the 1970s from what I would say is a kind of activist, social democratic way of going about things. So, for example, the ownership of potash in Saskatchewan. The idea that in Manitoba you should have government involvement in developing the hydro industry. That's a big difference between then the NDP governments that came along a little later, when neoliberalism, not just in Canada, but more globally, is becoming kind of the game, and that shapes the context of what is possible in some cases. So formerly activist governments in some of the provinces, NDP or otherwise, gave way to what I would term as a kind of Blairite form of left centrist politics, which to me is not actually really left or progressive or at times not even centrist. And has created real problems in Britain, for example, for the Labour Party. Key context, as I mentioned, is the NDP in Ontario and elsewhere often came into office during periods of economic crisis, and as I say here, sound familiar. I was saying to Heather earlier that the NDP in Alberta may end up, when historians actually write about it, may have been the unluckiest government in the history of this country, coming in at the time of such a severe recession, worse than we've ever seen for a long time in Alberta. And now actually some of the things they've done may actually bear fruit after the election, and presupposing they may not still be the government to take credit for it. An initial lesson here. That is that governments often adjust to the new economic and political terrain, and that suggests that governments in some sense are kind of independent from what goes on in society, and they kind of decide their own way of going. What I would suggest is the governments really are a product, a beast as it were, of the society they live in and of the people who support them, of the movements that are surrounding them. And so if you want your government, your type of government, a social democratic government, to act in a social democratic way, the key thing here is to actually push them and give them allowance to actually go in directions that they might want to go, but they're not sure they can, right? So they need to actually be pushed. Otherwise, the tendency to perhaps move towards the center, as we've seen, is very much there. But the other lesson that I want to emphasize here is that provincial differences remain, and they're also really important. And so as we looked at the 5 NDP governments previously and how they handled politics generally, but also healthcare specifically, they did so in the context of their own particular histories, the particular coalitions that underpinned their support, the kind of economy they had, right? It's all of these kind of contextual things that make it so that, for example, the NDP government in Ontario and NDP party since that time are very different in a lot of ways from the kind of prairie populist NDP governments that you've seen in the past in Saskatchewan and Manitoba, or even again the NDP government when it's been in office in BC, and of course in the case of the Dexter government in Nova Scotia. So very different contexts, same party, same general direction where they would like to go, but things play out differently in different contexts. So here's the first things I actually want to point out here. Going through the information about the, first of all, big financial pictures of the provinces here. We looked at the percent of GDP by NDP and non-NDP governments in terms of revenues and expenditures. Ontario, again, because of the very particular period, the difficulties of that time, you can see here that revenues are actually quite low, and in fact lower than the non-NDP governments. I suspect this is because of the small sample size, the years in question, but also because Ontario was in a difficult situation. At the same time, even there, Ontario ended up spending as a percentage of GDP more than did the non-NDP governments. And frankly, I think that was actually defensible at the time. There's other things I could say about how the Ray government handled certain things that I might not agree with. But in terms of strict Keynesian economic policy, that is, the economy is really down and government has a role to be kind of the group that is going to increase or maintain demand in the system. I think they actually probably did the right thing. They started to cut back at the end, but basically I think they did the right thing. Much like I think actually the Notley government in Alberta did after the price of oil tanked. If you look at the other provinces, the really striking thing here is that it's quite often suggested that NDP governments are not very good at handling the books in terms of expenditures, and not very good for sure in terms of revenue. So they end up running some kind of deficits and eventually debts. In fact, what you actually see is that revenue under the NDP governments tends to stand up higher than non-NDP governments. Yes, their expenditures are higher, but the record, by and large, about NDP governments, particularly on the prairies, and again, this gets back to a particular political culture, is that NDP governments on the prairies have been among the most frugal and the most economically, financially solvent of any governments across the prairies. Historically, they've always been really tight, if I can put it that way. And I think it goes back to the roots of kind of agrarian populism, and a dollar is a dollar is a dollar. And so they've actually been really good at handling the books. So this was one of the first things that we discovered is actually the NDP's record on expenditures and revenues stands up really well in comparison with non-NDP governments. And that includes, of course, here I'm putting under that umbrella in the various provinces governments that may have been of various kind of political stripes there that were not NDP. So to healthcare. What you'll see here, and I hope this won't affect your eyes too much, but this compiles all of the governments. And you'll see here the little orange dots are the period of time when the NDP was actually crafting the budget. And so these are over all of these years where you don't see a little orange dot. That means there wasn't an NDP government in office. It's a little bit of a messy picture here. But in general, if you follow the lines in this graph, and if you also go to the numbers that we actually present in the report, what you see is that by and large, the NDP has been pretty good and better than non-NDP governments in keeping up expenditures as a percent of GDP on healthcare. And so they've kept the level of spending and increased it usually over that which the non-NDP governments have done. So they've been real friends of healthcare by and large in all of the provinces where they have governed. A few general observations then on healthcare finances. Again, the NDP governments brought in more revenues and spent more money than did their non-NDP counterparts. And in many cases here, so this is kind of globally, in a lot of cases, the NDP has had to do that in cases of crisis where they've had to keep up demand in the system. That means spending money, but also spending money quite often wisely on things where there had been a great deal of neglect beforehand. So for example, infrastructure spending. Infrastructure spending is good if you need to have good roads, good hospitals, good schools, etc. And it also pays people to be doing something that is important to do anyway. So the effect of that is you actually stimulate the economy. So in the context of when NDP governments came into office, this was a really smart thing to do, but at the same time also bringing in the revenues to be able to do it. NDP governments in general spent more as a percent of GDP on health than did their non-NDP counterparts. We've just seen that in the previous graph. But here's the other point, and this one I didn't put up on a graph because it's kind of complex and it doesn't look great on a PowerPoint, but we do cover it in detail in the report. The public percentage of all healthcare spending under NDP governments was in general higher than that of their non-NDP counterparts. So just to elaborate on that. So let's imagine that all healthcare spending, so that's 100% of healthcare spending done either publicly or privately. What we actually see when we look at it is that NDP governments have maintained at roughly about 75% of all total expenditures being public expenditures. That means there's not a lot of people who are paying for those things out of their pocket privately for healthcare, right? Whereas the non-NDP governments, quite often the percentage of public expenditures drop. I'm not saying a lot, but it tends to have dropped during the time that they are in office. Do we wish, would we suggest that in fact the NDP should have at times increased the amount of public expenditures and therefore relieve the average taxpayer, the average citizen, of having to pay out of pocket? Yes, definitely so. And in fact, prior to the 1990s, this was very much again an idea that was there. If you think back to Tommy Douglas, public health care, etc., that in fact NDP governments would have spent more. But at least they've maintained and in some cases increased the percentage of public expenditures on healthcare in the places where they have governed. Again, they didn't increase a great deal at times, and there's areas where we think the NDP actually could have done a better job. Everybody can always do a better job. My teachers or my students tell me that all the time on my evaluations. But on balance, the record of NDP governments has actually been pretty good when it comes to healthcare. Some other observations here, and this is where we get into the trickiness of looking at 5 different provinces and finally looking even at the NDP in Alberta. Spending was highest and steadiest in the 3 western provinces of Manitoba, Saskatchewan, and BC, no matter which party was actually in office. So the NDP spent well on healthcare and in general in those provinces. But here's one of the really interesting aspects of this. This shows the power, the importance of NDP social democratic parties in the political system. One of the roles of social democratic parties, it seems to me, is to shape the terrain, not just when they are in office, but to shape it when they're not in office, to actually have changed the terrain in such a way that other governments coming afterwards can't totally back out of it and pursue their own particular agendas. That's a really important role for political parties and political movements. In terms of healthcare itself, the NDP in Saskatchewan and Manitoba tended to employ more healthcare staff across the job categories, and we looked at, for example, registered nurses, LPNs, etc., than did the other provinces and governments. So again, sort of that prairie populist social democratic tradition seemed to make a real difference in terms of even staffing levels and maintaining hospitals, which I haven't mentioned here, but it was also an aspect of that. The best labor relations were under the NDP in Manitoba. So the relations there were actually really good. At times in other places, they became a little bit fraught, particularly towards the end of the Rae's government's period in Ontario. As you may know, things became really quite difficult between unions and the government period. And frankly, I think the Rae government was finally running from capital at that point. They were petrified of the idea of capital strikes, and they were getting hammered every day. But labor relations in some of the other places at times have not always been as good as one would like, particularly, for example, at times in BC and also in Saskatchewan, but very good actually under the NDP in Manitoba. So what about Alberta's NDP? What have they done? I was just actually looking at the Alberta Views cover that just came to my desk the other day. So what's it say? Something like, so what did they do, or what have they done? What have they done for, anyway, yeah, and it begins to list stuff off. Well, in terms of healthcare and just focusing on that, they have certainly controlled healthcare spending while protecting frontline services in the province. So as you know, one of the things you've heard regularly throughout the election, it's one of those things every election, I know it's going to come up, particularly from conservative governments, is if we just cut, we're never going to cut frontline staff. It's always fat. There's this mythical fat is always floating around. I expect sometime going to be drenched by oil. It's just going to kind of burst in the sky or something. So there's always supposed to be fat there. But in fact, as has actually been talked about in some places the last couple of months, the figures from CIHI, which is where we gathered a lot of the information for the report, show that Alberta actually has the lowest, substantially actually, the lowest administrative costs of any province in the country. And that's to the result of the fact that over time, various governments, again, not just the NDP, but really have cut back on that thing, fat, right? So you kind of wonder at what point, how low can you go, sort of. Another thing the NDP has done is rebuilt infrastructure. And again, as I said, there was a really good reason for doing this, not just simply the fact that our infrastructure spending had dived. That's why successive conservative governments could boast about the fact that they could give away money to people, and well, because they didn't spend on anything that was useful. But the other thing was, it was really important to keep people working. And I actually remember a few years ago, conversation with Gil McGowan. The oil industry has been struggling in some sense for a while now. because I won't get into differentials, but we know there's a problem there. And I remember Gil saying, you know, what we actually have going on in this province is a construction boom. It's actually the construction boom that is kind of pushing money around and keeping a lot of people employed, right? Putting money in their pockets. Well, in order to keep that demand going, we also, again, through infrastructure spending, went a long ways towards also kind of constructing things and getting money into people's hands. So that's been very effective, actually. The government has ended contracting out of laboratory services. This is certainly controversial for those people who are working in those private clinics, but by and large, I think it was actually a really good move. And this is one area where the government doing this, I think, will save money. You know, we're still seeing the effects of that. But to bring things in-house is going to be much more cost-effective than actually contracting it out. They've increased funding for midwifery services, as we talked about in that report, and also some other things that we've done. They could have gone further, I think, in terms of rolling back many of the contracts that were put out by previous governments. And in general got a better handle on what we actually get for that contracting out, and I don't think governments in the past have done a very good job of that. Frozen wages for staff. Okay, in the context of the government situation where deficits, debts, we know people are always concerned about those things. We could argue one way or another. I know it's really difficult for a lot of people working in the field. But politically, one understands where that had to go. And finally, they also created a new payment formula for physicians. Short note here, physicians as a lobby group, some of you may already anticipate and know are not an easy group to deal with. And I don't think there's been a government in Alberta yet that has found it easy to deal with physicians, but they did come up with a new payment formula for them. So some big broad lessons again, some of which I've already talked about here, but I just want to emphasize these points and then we'll conclude with this and I'll pass on the baton here. The political culture of provinces and not just the party label is important. So one of the difficulties for the NDP in Alberta, it seems to me, is it's not as though we've, first of all, we've never had obviously another social democratic government, but the NDP hasn't even really been close as a challenger up until when they won in 2015. And so the process of actually changing a political culture doesn't happen overnight. To some extent, you actually have to be in office long enough to have the effect of doing that. And that's why, for example, there's a term actually used in political science. They talk about natural governing parties, right? And so historically, actually federally, and it's hard to imagine now given Justin Trudeau's difficulties, but the Liberal Party has always been viewed as kind of the natural governing party. It's sort of the party that when things go really wonky, because we let the other guys in for a while, but now we'll let them clean it up. The same sort of idea is actually very much part of the tradition of Saskatchewan and Manitoba, Saskatchewan more particularly, where NDP governments have been in office long enough that they're kind of trusted, right? They're the party that will set the ship right again, especially after years ago when the government of Grant Devine, when it went down partly because I think it was 14 or 16 members of the party actually went to jail, which is why the Conservative Party there had to change its name to the Saskatchewan Party, because they were so disgraced. And people said, well, yeah, but we can trust the NDP. They don't do those kind of things, right? So in those provinces, the NDP tends to be the party that is trusted to actually handle things in an ethical, with an efficient manner to make government actually work for people. But it takes a long time. You have to get in there. And the NDP's difficulty in Alberta is that in 4 years, everybody's saying, well, they didn't change everything around, right? They haven't fixed everything in the province. And that's really difficult. In that case, it's really easy, one can imagine, to go back to something else that people are familiar with. But again, political cultures are important. They change slowly, but they're fundamental to the way policies are shaped. Prairie NDP governments have often been the best defenders of healthcare and of workers. I won't go into that anymore, but I think the data is actually pretty clear, both from what I said here and what is in the report. Even when the NDP is not in office, what it does impacts the government's actions. That's where I say governments, parties and social movements more broadly, including everybody who comes from organizations such as the HSAA or UNA, other trade unions, other social activist groups, are important in shaping and controlling governments once they're in office. Some final points. NDP governments must be bolder in their actions and policies. This is where I said before that there was a change in NDP governments after really in the 1980s, and so the NDP governments that you would have seen in the 1960s and 70s, certainly going back to Tommy Douglas, but also Barrett in BC, that these governments were actually quite bold. Ed Schreier in Manitoba. These governments were very bold. They believed government had a role to actually control the heights, as they said, of the economy, to shape it to public purposes. And NDP governments have tended really to become, in many cases, overcautious. When in fact, I think there's a lot of people in the public want government to actually use the instruments of government to shape things more, and not just simply leave it to the corporations, many of which are in fact not here in Alberta or Canada, but elsewhere. And finally, the task of progressive parties and governments is not, it seems to me, just to move to the center is the easy way to go. You know, you can move to the center, nobody's going to oppose you there. But to move in a direction that constitutes reshaping what the center actually means. And I know a colleague of mine, Ricardo Acuna, talks about the Overton window, right? So that what you want to do over time is shape the window of seeing what is possible, what is politically possible to actually move things in a policy direction out there. And so be bold, don't be afraid of moving away from the center and reshaping what the center actually means in terms of political activity. And I do believe that is it. Thank you so much.
Thank you so much, Trevor. Thank you. Trevor, I do have one comment. Must be from a former student of yours. It says, you could do better. Thanks again, Trevor. And like you said, that's been a couple of years in coming, and the span of this report, trying to pick different moments in time, assess their healthcare systems on top of the funding models against the economy, a massive, massive report. I'm going to bring up the president of the United Nurses of Alberta. She's been this president for, she said, a while. I'm going to tell you, this is her 31st year, but and you know, she's only seen in that entire career 2 governments, the current one under NDP and the former one Conservative. But I will say that Conservative government, their Overton window has shifted over time, I would say, from the days of Lougheed through the days of the Kleins and to what they call themselves today. And I'm not sure what they call themselves today, but United, well, I'm not going to even give that, but I will say that Trevor took half of my statements earlier in his speech, and I'm pretty sure that Heather's going to take the rest of my statements, so I'm going to have to rewrite that speech again. But I will say this, that the enemy of my enemy is my friend, and my friend Heather Smith. Please join me up on the mic here. Do you want to use that one or this one? Sure. Folks, Heather Smith.
Hi there. So Trevor's report, this report was really, really important in so many ways in terms of putting into context what's been actually happening around us. And some of us, Mike identified, have been around a while. I do remember certainly the experiences of some of the other provinces, Manitoba, which only recently, fairly recently, went from a new Democratic government to a conservative government, and in terms of interacting with the nurses, which we do at a national level, for many years they had quite a stable landscape, and all of a sudden what's coming out of Manitoba is the kind of stuff that was happening to us in the 90s, and they are amongst a few other provinces that had NDP governments. They have just recently created something that we call the Friends of Medicare in Manitoba, because they are having the same issues of layoffs and closures and consolidation of emergency departments and all that kind of stuff. So the kind of moving that window to the right and reducing expenditures for public delivery, not necessarily reducing expenditures, but certainly reducing expenditures for public delivery. Same thing happening in Saskatchewan. I also remember the days when Bob Rae was in the Premier of Ontario, and with a little bit of, I remember how surprised I was that the unions didn't like the idea of what was called Rae Days, because basically what the government said is it was a rollback for them of about a 5%, but it was giving them a day. We actually negotiated that. We thought that it was so important that we had a reduced work week that in the 1990s, we actually negotiated. Hard won at the bargaining table was a 5% reduction in our work week at the time. But anyways, so coming back to where we are today, I think, and Mike and I have had a lot of discussions with other members of the Alberta Federation of Labor in terms of what this election means to us here in the province, and where that the Overton window is going to be at the end of the day. And it's just pure physics, right? It's exactly what you said. How much pressure we create and others before and after the election will determine how much that window either moves to the right or moves to the left, or at least stays as it is. But I'm personally quite optimistic that we are going to have an opportunity to see more progress that we have seen in the last few years in terms of some of the healthcare policy. Because one thing that is really important is in terms of looking at where we are and where the parties are that are sort of the pressures against moving that window. Clearly, one of the parties wants to move us back towards what Ralph Klein tried 3 times here in the province, which is to move us more towards private delivery, privatization, privatizing the labs, privatizing everything that's left in laundry that isn't already privatized, just in terms of healthcare, but also looking at private clinics with the suggestion that if we have more private delivery, that somehow that's going to relieve wait lists, which is a whole hocus pocus in terms of what wait lists actually mean in terms of evaluating the capacity and outcomes of any system, but wants to see us move what we currently are, many things that we are currently delivering in the public system into private environments. And of course, the problem with that is when you move it from the public to the private, the providers go, you don't have all of a sudden that they all clone themselves and you have providers staying in the public system and providers staying in the private system. If the service is moved into private delivery, the providers go, so you don't have more public capacity, and it costs more. I mean, we've known this for decades. We had all of these arguments during the Klein years in terms of the third way, which was not, don't say it's American, it's not the way we are today, it's a third way. But basically it was using public dollars for private profits. That's all it was about. And if you listen to Ralph Klein in the day, in the same way as if you listen to the leader of the UCP today, they very clearly always talked about being very supportive of public funding. And Ralph Klein was very supportive of public funding, public financing, but not of public delivery, public financing of private delivery, which just as an economic argument makes no sense, because when you go to the private, certainly they have some, you know, cost savings in terms of maybe lower wages. I know HRC used to encourage nurses who were employed there to keep a part-time job in the public AHS system so that they got their benefits over there and they didn't have to pay for their benefits. But those entities are in business to make money, to make profits. So for every dollar that we have in terms of a public dollar, somewhere between 10, 15, 20% of that has to be taken out of the equation for profit margins. So immediately your $1 of public money for healthcare is now only 80 cents. So it's my mind is an absolute no-brainer. So there's lots of stuff that's been going on, and I hope you've shown your commercials at some of these sessions, or you're showing them again today in terms of the great things that Health Sciences has put out in terms of messaging that cutting hurts and cutting will hurt. And interestingly, when I was preparing a presentation for Public Interest Alberta, which had their conference last weekend, was pulling sort of a history of what happened in the 90s and the 2000s. And one of the first pictures we had was actually a picture of Ralph Klein as Ralph Scissorhands. And so that's coming. But one of the other things that we've been doing as healthcare unions and as members of the Federation of Labor, and with our friends in terms of Friends of Medicare and Public Interest Alberta and stuff, is looking at what kind of things would we want to see in terms of that window of healthcare delivery. If we had if we were to do what we would say is a healthcare guarantee, a real guarantee of public healthcare, what would we include in it? So I'm just going to quickly go through some of those items and then I'm done, okay? So we would ask the parties to commit to maintaining and supporting a single-tier public healthcare system that ensures access to necessary medical care is based on need, not on the ability to pay. That we would look for a party that is interested in providing basic healthcare services consistent with the Canada Health Act, shortening wait times and facilitating greater access to public healthcare by funding hospitals according to need and to ensuring there are enough healthcare professionals to meet the growing demand of Alberta's population. Standing up against privatized service delivery, prohibiting two-tier medicine and extra billing, or any other form of private payment in relation to insured services. Prohibiting queue jumping by reason of a private payment. Implementing a universal pharmacare program. Phase in and expand public delivery of home care and facility-based seniors care, so expanding the whole seniors umbrella. Work to expand the scope of our public healthcare system, support mental health services and addiction services and care across the province, increasing the number of long-term care beds and introducing a minimum standard related to how many hours of care these people actually have in terms of hands-on care. Prohibiting the practice of dual practice where professionals work simultaneously, can bill in the public sector and work and bill in the private sector as well, and fair spending increases in healthcare that at minimum keep pace with inflation and population growth. So those are the kinds of things that we would see as a healthcare guarantee here in the province, which is very different from some of the stuff that we have been seeing, at least in one of the party's platforms, and is certainly very different from what you may have seen. Some of you may recall that in February, coincidentally, the Fraser Institute released something called the 7 Ways to Improve Alberta's Healthcare, which absolutely included private delivery, introducing means testing for cost sharing of treatment and all kinds of stuff like that. So we'd be on the side that's pushing, trying to keep the window going this way in terms of making our healthcare umbrella better and having an opportunity to actually fulfill what we think is really important. Okay. Yeah. Okay.
Is it? There we go. Thanks, Heather. That was great. And I got to cross out a whole bunch more pieces on here. I didn't hear you mention anything about pharmacare And dental, eyes, where does that fit into your conversation, by the way? As a question to you, how about that?
Oh, of course. I mean, Tommy Douglas, the job was only half done in terms of physicians and hospital care. It's unfortunate that places like Saskatchewan actually did proceed to do dental care, but then pulled it back. But no, we need a more comprehensive plan for care for seniors right across. We need a pan-Canadian level of care in terms of seniors, and certainly pharmacare. We are getting, well, we're closer to achieving pharmacare than we have been in my time as a president. But we have to keep that push on, because right now there's the big threat is, of course, from the pharmaceutical companies and insurance companies who only want to see a top-up plan instead of what I call the full meal deal in terms of a full pharmacare plan. But no, absolutely. But in terms of having a government that will, at the provincial level, push to make that a reality at the national level is very important. And I'm not sure that all parties would agree that that's a priority.
Absolutely. You know, it's interesting. One of the biggest opponents to Medicare back in the day, back in Tommy Douglas's day, was the physicians, because the physicians were the one getting to direct bill the patients, and they liked that, and the insurance companies were involved in that, and the whole idea of a single payer system meant that they kind of lost a bit of that control. And you heard in Trevor's report talking about a renegotiation of the fee structure for physicians. Well, you want to talk about a powerful organization. I'm not going to give them the credit of calling them a union, but they're an association. That's the CMA, or the AMA, I guess, in this province, right? And the Alberta Medical Association has that kind of power. Folks, again, we are more than happy to take questions. I have a few comments here, but if you have something to say, please let me know and we'll get you in on this. Please, Trevor. Do you want to come over here and join me? Yeah. Just for the folks at home, they can.
Yeah, so as Heather was saying, and I agree totally with actually everything she was saying there, just one quick note about the privatizing of services, or the outsourcing but using public money to put it in private hands. One of the other things, and Parkland's actually done a lot of reports about healthcare issues, and one of our reports was about private clinics, these boutique clinics that came out a year or so ago. And of course, some of those clinics have gone belly up. And so one of the things, it's not just that they're more expensive, but they create a huge amount of instability in the system, because suddenly you have patients who are stranded. The other thing is that, in fact, when you outsource like this, you have less public oversight about what's going on. So there's this kind of magical idea that you contract out and you can always pull the contract on these people. Doesn't happen, because these guys are way too big to pull the contract, so that even if they're not doing a good job, they tend to keep a long time. But the other thing, the real thing I wanted to stress here, of course, I just actually finished teaching, and I'm going to have to get those evaluations, I guess, in a while, is actually about social inequality. And in it, we actually talked a lot with my students about healthcare issues. And one of the things that, all of the things that Heather's talking about is, pharmacare, dental care, all these things. We lack a real imagination in this province, in this country, about what we can and should be doing. We look too often to the United States or someplace. You look at Europe, and you look at countries that actually, in a lot of ways, are very conservative, the kind of welfare state programs they have. Even there, the kind of programs they have in terms of dental care and kindergarten, all kinds of programs, and we don't look across there, and yet these are very prosperous, very well-functioning places that take care of their people. So we need to start to use our imaginations, go out, find the evidence for where there are other models where we can actually go with our healthcare system. And it includes all of those things that Heather was just talking about.
Thanks, Trevor. Self-regulation is one that I hadn't put together until you just made that connection for me, because Walkerton tried self-regulation on their water. Brooks Packers tried self-regulation on their meat inspections, and we know how those turned out. So just in my mind, I just thought about that for a second. Self-regulation from a big corporation on my healthcare. That doesn't quite fit in my head, and yeah, in the report we saw the spending was up. But the NDP governments that were studied in here were also producing the best balanced books across the country as well. It's not like they were driving the country into the hole. Alberta would be argued. I'd like to hear maybe your comments on that, Trevor, for a second, because when I was maybe visiting friends and neighbors in a neighborhood knocking on doors, the comment was, but the debt. You know, so maybe add that in a second here and we can talk about that one. And it's interesting that how under the neoliberal context, and this comment, the neoliberal, I sat back years ago and don't even know what the hell that means. Now, if anybody's like me, you had to go look it up and go, dear Google, what does neoliberal mean anyway? Let's go through that for just a quick second. A neoliberal conversation would say you devalue or defund public sector, you make it kind of worthless, and then you offer up a better option over here called a private company. And there's the whole conversation, really in a three-sentence nutshell, is that you starve out private or public sector, you offer up an opportunity over here that might be your buddy, might be whatever, big pharma, might be who knows who, that's offering to do that exact service. And then you privatize it to them. Now, garbage collection is what I'd give you an example of. Do we all need garbage collection? I would argue yes. We've seen some strikes in the East that don't go well when you don't pick up the trash. So if we all need garbage collection and if we all pool our money to have the garbage picked up, I would argue that's probably the best and most efficient way to get my trash to the dump. But somehow, and as Heather alluded to, if I paid someone else to do it and they are beholden to shareholders, certain lab companies that operate in this province currently, must turn a profit. They must turn it, because as a shareholder, I just put my $100 a month into my RSP that's investing in a private lab company in Alberta, and I want to see a return on my investment. Otherwise, I'm not going to put money in. So tell me where that savings comes from. Two places, the backs of the workers and their pensions. That's it. That's the only place, because a garbage truck still costs the same, the gas still costs the same. The profits get made off of the workers that are out there doing the jobs. I want to go back to a comment that was made on cutting the fat. And we've heard that recently. Trevor alluded to that we are the lowest administrative costs in the country, by the way, of the largest employer in the country on healthcare. In the 1990s, Klein cut the fat as well. And we'll go to, some of you have heard my story already, the small town of Coaldale where I grew up. And my mom was an admitting clerk, and they were going to cut the fat in that hometown. So they started with the administrator and said, administrator, cut some fat. And he said, well, it sure as hell isn't me. And it's not going to be my admin support or my payroll, because I need a paycheck. Well, some of these higher level people, like, I don't know, the docs and whatever, they need a job. Who should I cut? Well, let's just keep moving down the line until we hit the admitting clerk. And they said, dear admitting clerk, you're out of a job. No, sorry, it was laundry. My apologies, it was laundry. And in laundry, they said, we're cutting the laundry position. And that laundry person was my mom's friend in that hospital. You all think about that person that you are friends with. So laundry person's out of work. She turns and says, let me show you what bumping looks like. And my mom's friend unemployed my mom, technically, in those days. And that's what it looked like back then. So cutting the fat doesn't cut the fat that they keep selling. We're not bloated with 22% administrative costs in Alberta Health Services. And at the end of the day, it is the front lines that feel the pinch on that. So I would argue, don't ever be blurred by the fact when they say we're going to cut the fat. We've been cutting fat for as long as Heather's been president of UNA. We've been cutting fat in healthcare. I would argue that there is no fat left, and we're cutting the bone chips off now, because there is nothing left. If you tell me that out on your work sites, there's a lot of waste laying around, I would say, well, I mean, hey, could you argue? Yeah, there's maybe something that I could think of in healthcare I could save $20 on. I'm sure all of you could. But it's not the multi-millions of dollars. Healthcare is a $4 billion industry in Alberta for AHS. My apologies, $22 billion. If you slashed all education and all hospitals in this province, we still wouldn't touch the current deficit. So close every school, close every hospital doesn't explain why we have such a debt. The explanation for our debt is our revenue side is in trouble right now. So I'm feeling like I'm rambling here. I'm going to turn back to the crowd and say, anybody got any questions out there from what you've heard tonight? And there's giggling, so I guess I'm going to keep talking a little bit longer. There we go. Thank you very much. I have a mic for you because we have a online crowd. You want to go that way? I'm not gonna put a name to what that, yeah.
Well, just a comment about cutting the fat, and I agree, there's no fat left to cut. And I worked through the 90s and went through the bumping, and with a dear friend bumping me, and me having to bump dear friends, and that was the way it was. It was horrible. But the impact of cutting the fat doesn't just stay with that time period. Like, we are still feeling the impact of the Klein cuts. And whether we're talking healthcare or public education, the impact of those cuts will snowball for at least the next generation will be impacted. So if we do end up with a government that thinks there's things that can be cut, we'll be paying the price 10, 15 years down the road, the same as we're still paying the price now in healthcare. And so it's our children and our grandchildren that are going to be the greatest sufferers of this, because the cutbacks that they'll experience in their childhood will impact lifelong learning, if it's cuts to education, lifetime health if it's cuts to healthcare. And so it's a scary thing, and hopefully we'll never have to go through Klein type days again, but it's up. That decision is in our hands.
It's in our hands right now, and it started yesterday when the polls opened. I got a question in the back. I got Trevor. Do you want to comment on that one as well, or? Yeah, sure.
Yeah, that's absolutely true. It's almost become kind of a fable that's passed on, but quite a correct one. We know that during the Klein years, we lost a lot of nurses, we lost a lot of teachers, and what's unfortunately happened here, and right of center parties, although I have to say there is kind of a difference in the Conservatives, I think, between Lougheed and the Klein years, but we spent 10, 15 years trying to rebuild that, not just the physical infrastructure, but the social infrastructure, and we lost a lot there. And that, it's two different ways of thinking about the economy. The way that conservatives, really hard right conservatives quite often think about it is, in this province, oil is the only thing that matters. Everything else is a nice little add-on that if you have the money, maybe you can spend on it, but it's not really important. The other way to think about it is, these are actually real jobs, and they are actually what makes the economy function, right? Education systems, good healthcare, not having homeless people on the streets, fixing your roads. These are all the things that make for a good economy and a good society. And you can't narrow it just down to, do we get pipelines, right?
Thanks, Trevor. I'm going to get a bit of crowd participation before I hit the question in the back there. Go back to the 90s and let's talk about our telephone system, privatized. Our water and sewer, privatized. Help me out, anybody else? Our liquor stores, privatized. What else we got? Hey? Licenses, privatized. Highway maintenance, privatized. These were things, again, that we all needed. We all have to have telephones and licenses and clean highways. Again, the most efficient way to do them was for us to keep them in-house and not have them for profit. Jerry, you had a question?
Yeah, Trevor, I was really taken by one of your last points, which is that NDP governments need to do better, they need to be bolder. And that kind of struck me because I'm watching the trending in the polls, and I'm encouraged that they are narrowing, and I think we might just be in danger of having a second NDP term here, which would be wonderful. But we've been spending, I think I would argue, a good deal of time bracing for a defensive posture, and especially in healthcare, and not preparing for demanding better from our NDP government, a second term of an NDP government. Can you suggest some of the things that that we might be asking for of an NDP government going forward?
Thanks, Jerry. And for the folks in the room and online, when the NDP first formed government in 2015, we called in some of the folks that were labor leaders across the country and represented by some of our demographics here. And they all said, don't let your foot off the gas. Push harder, because we stepped back, we sat down, we didn't push. And the question would be asked, I guess, from us today, did we push hard enough? But Trev.
Yeah, I think there's a couple of things. I think they have been really cautious, and of course, if you're going to do bold things, you should do it in the first couple of years, if not the first year. After that, you're already on, preparedness for the election, and so everything fades. I think they could have been bolder in terms of crafting a real vision. I think they do actually have a vision, more than I would say the UCP, or in fact, probably some of the other parties running, in terms of where we want to go in future. Right. So let's think of a really bold thing. I've been for 20 years saying we need a bullet train between Edmonton and Calgary. I think people get excited about the idea that we're going to be a 21st century province. Instead, at least from one party, we're getting retread policies about we're going back 10, 15 years, because here was a great policy the Conservatives had back in 2000. I think we did need to be more bold. The other thing is, I think that if you're going to be bold about going into the future, though, you have to do a better job than the NDP has done at times at laying out for people, here's the future, but here's how we're going to get there. And I was saying actually to Mike earlier, this election to me revolves around three things: anger, fear, and greed. And a lot of people understandably are fearful. If you can show them, though, this is how we're going to get you to that place, you're not going to be without a job. Those skills you have are going to be very applicable in the new economy, but we have to lay it out for them. The final thing, of course, is everything is possible with money. And Conservative governments for decades have convinced Albertans that they can have everything and never have to pay for it, that there is, in fact, a free lunch. What used to be actually kind of a Conservative slogan, there's no such thing as a free lunch. What Conservatives say is that there is such a thing here. We undertax next to the next highest taxing province in Canada, BC. If we were to tax at their rates, we would have about $11.5 billion more. And of deficit, and of debts. We could even bring in a sales tax or various other taxes and tax $10 billion more, and we would have no problem. And we'd still be the lowest tax province in the country. If you want a real contrast, tax at Quebec's rates, and there's $22 billion more. Now, nobody probably wants to go there, but when Albertans say, oh, geez, we're sending all that money to Quebec and look what they're doing, blah, blah, blah. Well, they tax everything, right? We don't have to be in the deficit and debt problem that we're in. It's just that people have gotten used to governments supplying things and then not getting them to pay for it. And that's created a real problem because the NDP doesn't have a lot of room to move there, right? But it is a revenue problem, essentially.
Thanks, Trevor. You know, it's interesting too. I'd like to know about transfer payments, or health, what do they call them? Health transfer payments that did come from Ottawa that started off at a specific per person, per cost. I believe like $6 or $8 or whatever per person that used to come out. And it's been a steady decline to the point where this year they said, we're not going to give you really anything, but we'll give you a couple of bucks specifically for mental health and specifically for a couple of the pieces. I forget what they were. And this was part of our calculation in our healthcare budget as well, that has been declining and declining, the neoliberal decline in our healthcare based out of a federal government impacting us.
Yeah, I mean, I'm not absolving the federal government here because they've actually really got out from underfunding Medicare the way they should be doing it. So they should be funding an awful lot more. But there's also things we could be doing in this province as well. Yeah, I won't even get into the equalization thing, which is the stupidest argument in the world. But anyway, nobody understands it really.
Uh-oh, Heather's coming on. That let her up. All right, here we go.
No, but we are part of Canadian Federation of Nurses Unions, and we're saying we've been, the federal government should be returning to paying 25% of the costs of healthcare. Remember when we first got into Medicare, it was a 50-50 split. It isn't just that the federal government has has reduced its participation. It transferred some of its participation. It gave the provinces, because the provinces wanted the ability, what they call tax points. So some of the reduction from 50% has actually been at the request of the provinces so they could tax. And Alberta is one of the provinces that has never used the tax room that they got from the federal government. So there is, yes, I mean, there used to be a lot of, Ralph Klein used to say, oh, we're only getting 17 cents on our dollar. Well, that's because you choose not to use tax room for one thing, but we would like to see a clear 25%. But what's important is what Trevor was talking about in terms of the public versus private, because when they talk about healthcare spending and high numbers, they're talking about the whole tamale. They're talking about all the money that is spent, whether it's out of the public pocket or out of the private pocket. And what's important is watching that balance in terms of how much of our total costs are being paid for publicly and how much is being paid for privately. And we've experienced some of that shift in terms of how much is publicly paid for in Alberta and how much is privately paid for. Just as a little example, people may remember that when Ralph Klein was elected, everybody in this province, whether they were newborn or they were 100, had eye examinations paid for. That was one of the first things that was actually pulled out of the public basket, meaning instead of it being paid out of our public dollars, it came out of our, the dollars after tax dollars. So that balance is something that's really important and something that we will need to keep a close eye on in terms of whether or not the government moves to a greater portion of that pie being privately paid for, because it doesn't matter to us. I mean, we're paying out of one pocket or the other, and we get the difference is that we get a whole lot better deal when we collectively buy the products.
Thanks, Heather. Friends, sometimes as workers, we don't make the connection between our front lines of healthcare and government. How a working relationship improves the lives of the working person out on the street. Governments do counter-cyclic spending. We heard about that earlier today. They build roads and highways when labor is cheaper. There was an overpass built in South Edmonton we were just talking about that ballooned at 3 or 4 times its expected cost because of the hyperinflated economy, because of the construction booms that we were experiencing here. The current government has dealt with school repairs, school builds, hospitals, jobs. These are again back to this cycle, like putting people to work, and that's part of that report that we talked about. Back to that healthcare spending. They maintained our spending. They had a choice. They could have dropped it like the 90s. They could have cut like the 90s. Our labor relations are improved today. Our OH&S are improved. WCB is improved. Labor codes are improved. These are the things that have been improved in the last 4 years with a government that we can talk to. What you saw here was that they're not overspending historically across the country. They are spending on average the same as anybody else was on healthcare, maybe a little bit more. At the end of the day, folks, coming up, we have a decision to make, and I would hope that all of you and encourage you all to make that decision. Voting polls are open across this province. You can vote anywhere you want. I might just drive down to Lethbridge, but I already voted. So I would encourage all of you to remember that health matters. Thank you to Heather, thank you to Trevor, and thank you to all of you for joining us tonight. It's been an absolute pleasure. Thanks.